Well, hi, good afternoon, and thank you for joining us again here to, go through some of the scenarios unfolding across the central and western region of New South Wales. I'm Dougal Saunders, joined today by Scott McLaughlin, who's the CEO of the Western New South Wales Local Health District, Assistant Commissioner Jeff McKechnie, Western Region Commander for the Police, and Stephen Lawrence, who's our Dubbo Regional Mayor. We'll talk a bit about how the vaccination rollout's going at the moment. We've got media standing by to ask questions a bit later on as well. But first of all, to the new cases for our region. Up until 8 o'clock last night, 24 new cases across the health district, 14 of those in Dubbo, 1 in Mudgee, 1 in Parkes, 1 in Orange, 1 in the Coonamble Shire, and 6 at Gadooga. That's a cumulative total now for the health district of 283 cases, and Dubbo has 234 of those. Now, Scott will provide a little bit more detail, but I can tell you that there is obviously interest in the infectious period of people being in the community. Around a quarter of those have been infectious in the community. We certainly know in Dubbo, Parkes and Orange, over half of those are still being investigated. The main message, though, is that look, we know in just about all of our communities at the moment there is a very high risk of COVID. If it's not already there, there's a very good chance it will be. So we're asking you to do everything you can to follow the stay-at-home orders for exactly that reason. 6,000 tests across the region, which is up a little bit on the last couple of days, so that's good. We're encouraging that to continue. Please keep coming forward with the mildest of symptoms or if you're concerned. And concern might be around where you've been, where there are casual contacts or close contacts. If you're a close contact, you absolutely have to isolate for 14 days and get tested. If you're a casual contact, you need to get tested until you get a negative result. It's fairly simple. It's updated regularly on the Western New South Wales website, also on the New South Wales Health website. We've got a post to exactly where to find all that information on this post happening right now, so you can follow a link from there. It's updated across various Facebook channels as well. Part of the message of what we'd like you to do is also communicate that with the people in your life who may not be able to get their news any other way than from you. So people who aren't on social media or following mainstream media, it's a really good chance for you to be part of their lives and tell them what's going on. If you know somebody shops regularly at a particular place and that's now a venue of concern, please keep them in the loop on that. As far as the vaccination pop-ups are going, look, we've got a pop-up here in Dubbo that operated across the weekend at Pioneer Park. It was extremely successful. A real thumbs up to the Health District, the ADF, Council for helping out, and all of the volunteers who were there across the weekend. Huge numbers, which is really positive. Today and right now, there are people queuing up outside, out of the rain, in front of the Dubbo Regional Theatre and Convention Centre. That will be the same for tomorrow. There is heavy rain forecast overnight again, so we're making the call now that Pioneer Park will be off for tomorrow. That pop-up clinic will remain at the Dubbo Regional Theatre and Convention Centre tomorrow. It's open today through until 4:30 and again tomorrow from 9 until 4:30. All of that will be in this post as well. Again, please share with people who may need that, and it's a great opportunity to come and line up and get your first jab straight away. It's been really well managed. It's one of those things that, yes, it might take you an hour or two to line up. Think about others, keep distanced, bring a bit of food and water with you and you'll be fine. If you don't have a Medicare card, please bring your individual identifier health number if you have one. If you don't have that either, bring some sort of ID and you will be able to get the vaccine. That's a guarantee. From today, of course, we've got the ADF and our health team spreading right across the area. So today in Warren and again tomorrow, Burke tomorrow, Wednesday and Thursday, Parkes tomorrow, Wednesday and Thursday, and Narromine Wednesday and Thursday, and so it continues again. Details in this post about exactly where the teams are going and when. We don't have all locations and all times for all areas yet, but this stretches out for an entire month. So all of that will be updated. And again, we'd like you to really include people in your circle, so as many people as possible know about these pop-up clinics. This is a really important part of our transition. Wellington, of course, has its own vaccination clinic and it is open as of today. The number has been running red hot, 6845 5423. We'll make sure that number's in the post as well. That is for bookings only. The Wellington Clinic at the moment is only taking bookings. That's happening at the Wax car park, a really great collaboration there. It's open through until 4 p.m. this afternoon. It's running 10 till 4, Monday to Friday. Still being assessed as to whether we can make that a walk-in clinic at some point, but at the moment it is for bookings only. That number will be very busy, so keep trying it and you'll get a booking eventually. More appointments as well popping up all the time at our other locations, so that includes the Dubbo Vaccination Clinic. Now, you may have heard that is moving as of tomorrow. So it's been functioning at Monera Plaza in Dubbo. That will move to the Woolpack Pavilion at the Dubbo Showground from tomorrow. If you've got a booking, you will have already been contacted about that tomorrow, and you will be if you have a booking. But a good one to know. It's about having more room, more ability to take more bookings, and we're running 12 hours a day for that vaccination clinic now again through bookings only, and there'll be very clear directions. It's off Wingewarra Street and Chelmsford Street, runs parallel with the railway line there. That will be the entrance into the showground for that particular clinic, and it'll be very well signposted, and more plans in place around the showground as well. So keep doing that, keep booking with your GP, keep checking with your pharmacy. AstraZeneca available in lots of pharmacies now. We want you to keep trying to get that vaccination, whatever will work best for you. As far as testing clinics, all of the testing sites that we've been operating with are remaining open and will continue to remain open. We do need you to keep doing the right thing and coming forward. Shopping, obviously, a fair bit of planning needs to be done by you and your family now. We know there's been extra pressure on all sorts of supermarkets around home delivery and also that click and collect scenario. If you are doing that, be patient, try and plan ahead, and we're trying to help out the supermarkets as much as possible to make that a smoother transition. If you are going to the shops, try and make it just one person from the family. Obviously, if you need to take children for care, that's fine. If you need a support person with you, that's fine. Just don't take the mickey. We're not using it as a group outing. We're using it to get essential goods. There is, again, a lot of information here. Scott will expand a bit more on some of that health scenario that we're talking about. We would like you to try as much as possible to find the information. It is freely available, mostly in these posts and also other posts we're doing, and on the New South Wales Health website and the Western New South Wales Local Health District website and Facebook pages. We are all swamped with questions all the time. If you can try and find the answer yourself first, that makes it fantastic and really helpful for us. And keep being kind, the message of love and kindness. We have people in our community now who are very ill. We need to keep thinking about that. This is a health problem. We can all be part of the solution by providing that health, that help, that love, that care and support that we're all capable of doing. So with that, I'll hand over to Scott for some more details.
Thanks, Dougal, and good afternoon, everybody. Again, for another concerning situation in Western New South Wales. I don't want to start talking about numbers. I want to start talking about us as a community and as a region, pulling together and doing some things differently that can help stop the spread of this Delta strain that is ravaging right throughout Western New South Wales. What we need to assume it is in every community, in your next door neighbour, the person down the street, or you and yourself could be the next person spreading Delta in our communities. We know that there's been a lot of concern around locations of concern being identified, other information being portrayed in different ways. What I really want to ask everyone to think about is the things that you can do that can help us stop COVID spreading around our communities. But we're still seeing way too much movement around homes, around the community outside of homes. We're still seeing way too much movement between communities. And so I really would ask everyone to please stay at home and just stop moving as much as possible. The locations of concern that are being updated regularly on the website are being done as quickly as possible through our contact tracing teams. There's some things that might be a bit confusing, so I want to make sure that there's some clarity around this. Now, one of the first things we do is to contact all of the people that have been in a location of concern that we know about. If we're sure that we've been able to contact all of those people, then there's no use in portraying that information publicly and concerning everyone. So that's the first step that we absolutely do. If we're also sure that someone's come into a venue and there was no chance anyone else was in there, let's say it was a service station late at night, and we know that there was no one else in there, then that information doesn't get put out publicly. We do understand the effect of asking people to isolate if they've been a close contact or a casual contact until they've been tested. I know that's hard for some people, but please, this is the most crucial time for us to stop and stay. Don't leave your home. if you've been confirmed as a close or a casual contact for locations. The testing times are improving and turning around much more quickly. So when we put the call out to ask everyone to come and get tested, it's everyone. We know that COVID can be lurking around any of our streets, any of our homes, any day of the week. We're seeing record low testing numbers in some of our communities where we know we've got confirmed cases who have been infectious in the community, where we know we've got sewage samples that are confirming there's someone in the community. And so please, can I urge everyone, this is serious, it's for you, but it's for all of us. If you've got any signs and symptoms, however mild, then please come and get tested as quickly as possible. So to update on some of the numbers across the whole of the region, we've now got a total of 283 cases in Western New South Wales. The vast majority of those are in Dubbo, but a growing number in a lot of other communities. To 8 p.m. last night, we had 24 new cases. Out of those, 14 are in Dubbo, 6 in Gaduga, 1 in Mudgee, 1 in Gulaganbone, 1 in Parks and 1 in Orange. Now that's a further spread into new communities. There's growing numbers in some of our smaller communities, and we need to assume that COVID is in every one of our communities and households right across the region. Overnight, there has been an additional 5 cases identified in Parks. They are contacts of the other case that has been identified, but we know that some of those people were infectious in the community, so a particular call out to the community of Parks. Please come out and get tested. The drive-through testing service is available today. Out of the patients in hospital, we now have 13 patients in hospital, 5 of those in intensive care. That's a growing number and it's a worrying impact for us. One of those patients is ventilated. This is the thing that we don't want to see happen. There's people getting really crook and ending up in hospital. It's no good for the people that have got COVID, their families, our staff that are our precious resources, trying to save lives every day of the week. This is the thing that really should be front of mind for us. Get in front of COVID, help us find out where it is, and importantly as well, getting vaccinated. We now have 177 patients in our care in the community services, specialist services going into homes right across the footprint of the region to help people staying in the homes and providing care for whether they've got COVID or other concerns. We've now got over 110 venues of concern listed. I'll ask everyone to go and have a look at these. If you have been in any venues of concern, follow the advice of whether it's a close contact location or a casual contact location. We've now got 86 in Dubbo, 12 in Mudgee, 8 in Orange, 3 in Parks, 2 in Bathurst, 2 in Burke, 2 in Narromine, 2 in Wellington, 1 in Lightning Ridge, Nyngan, Walgett and Gilgandra. Those numbers are continuing to grow. There's additional locations of concern being put up on a regular basis. In terms of sewage testing, we've had now 10 locations in the last 48 hours come back with positive COVID fragments in the sewage. 2 of those in locations where we don't have active cases at the moment. 1 in Cobar and 1 in Canamble. Can I please ask those communities to please come and get tested as a matter of urgency? If you've got any signs and symptoms, however mild, or any concerns, then please don't hesitate in that. We've got rapidly expanding locations where we are testing sewage, so we'll come back and update this on a regular basis. Now the testing numbers rose slightly yesterday from the day before, but still less than half of what we would want to see across our region, particularly around Orange, Bathurst and Parks, where we know we've got new cases that have been infectious in the community that do pose a risk to the whole of the community and communities surrounding those localities. We know that Bathurst and Orange are regional hubs, and there may be people that have travelled in there over the last 4, 5, 6 days while someone's been infectious in the community, and so please, everyone, be on the watch for any signs and symptoms and come and get tested as quickly as possible. Now, as Dougal announced, all of our testing locations will continue right throughout this week. We're in particular scaling up the testing location in Bathurst, and so there is short lines there at the moment, and I really would encourage people. I know the weather's not nice, but you get to sit in a nice warm car and wait for the test. So in the last 24 hours, there was around 2,400 in Dubbo, around 130 in Mudgee, 1,300 in Bathurst, 1,200 in Orange, 74 in Parkes, 157 in Wellington, and a lot of other testing going on in smaller communities. It's still a lot lower than what we would want to see as a surveillance solution to help us figure out where COVID is lurking in our region. The healthcare workers that we've got off in isolation are still around 130 workers in total. Only 21 of those, though, have come from a workplace exposure, so a lot of our healthcare workers are close contacts of people in the community that have been confirmed with COVID. There are some changes that we're starting to make to some of our hospitals that is worthwhile everyone being aware of. They're changes that we've had to plan over the last 12 months for a situation like exactly this, where we know we're going to see more and more patients coming into hospital in coming weeks. The first change that's happening is Narromine Hospital is being converted into a dedicated hospital for the care of COVID patients, particularly for patients that might come from some of our northwest rural and remote communities like Cobar, Burke, Brewarrina, Ninken, and those type of communities. We know that we're going to need patients closer to our intensive care and highly skilled clinicians in Dubbo, and so just wanted to signal that that's a change that's coming in later on this week. You might have heard that there's some work going on at the hospital to help it be fit for those environments that we need to care for COVID patients in. In Bathurst, we've started to make some changes to expand the footprint of the emergency department. That's allowed us to expand into the Panorama Clinic environment. Now that's a subacute mental health service. The vast majority of those patients are now being cared for, in coming days will be cared for in the home, with specialist services going into the home, and I think a good and better solution for some of those patients to be cared for. And in Dubbo, we've moved to have some kids accommodated in the paediatric or the kids ward in Dubbo that are either confirmed cases or close contacts and needing some accommodation, and so that's been a change that's required us to utilise those beds for some kids. In terms of vaccination programs, right across the whole of the region, we've got over 50 locations today that have got vaccination available, whether it's the GPs, the pharmacists, the Aboriginal Medical Services, the respiratory clinics, our Australian Defence Force vaccination program going right across the region, or the local health district hubs and mobile teams. So please look out for those opportunities coming up. We want to fast track Western New South Wales to being the highest vaccinated population in the whole of the country within the next 6 weeks. There's a perfect window of time for us all. There's a lot of AstraZeneca available right throughout all of those vaccination providers. It's a high quality, good, effective and safe vaccine, so please can I urge everyone to look for opportunities for both Pfizer and AstraZeneca. Those Australian Defence Force hubs that were in Dubbo over the weekend did an amazing job. We saw nearly 1,500 people come to get vaccinated over the weekend. There's a big line up here today in the regional theatre, and so I really would encourage people to look for opportunities with the walk-in Australian Defence Force programs that are going right out across the region in coming weeks. So I'll pause there and hand over to Jeff McKechnie. Thanks, Jeff.
Thank you, Scott, and good afternoon, everybody. Just from a policing perspective this afternoon, to commence with, additional police from right across our region and from Sydney, in fact, are now operating in Western region. We've got additional officers from Sydney here in Dubbo supporting the ADF with our our compliance, our wellbeing checks, our deliveries to people who are currently isolating. So you'll see those folks around. We've got additional policing resources into Burke, along with ADF and Wilcannia from today as well. So we are moving our resources around to where they are most needed. Still a level of non-compliance across right across Western region. In the last 24 hours, 150 tickets, infringement notices issued for people not complying for various reasons. And here in Dubbo in the last 24 hours, again, another 30 infringements, similar numbers to the days before. So we're kind of bottoming out at this level of non-compliance, which is still totally unacceptable. Too many people moving around when they shouldn't be, when there is absolutely no need to be. Now, adding another dimension to that today is the new face mask wearing requirements. And from today, if you're outside your home for whatever reason, unless you're actually doing some vigorous type of exercise, you have to have a face mask on. That's a $500 infringement notice, and really, we don't want to be handing out those infringement notices to our folks, but obviously we will if we need to get those messages across. The time for warnings on all this has passed, and people will be expected to have those face masks on. On my way here on the police radio, I hear jobs going over the radio to attend supermarkets for people not wearing their masks. There's no excuse for that at the moment. Unless you've got a medical condition, carry that documentation with you that says you don't need to wear a mask. Otherwise, you are going to get that infringement notice. But that aside, the risk around it all is that you have COVID, or someone you are close to has COVID, physically close to. So it's more than an infringement. It's more than the penalty. It's about looking after yourself, looking after your loved ones, looking after your community by doing the right thing and wearing a mask and just adding that extra layer of protection at this really vital time that Scott talks about. COVID is spreading across the region. Some of our small places that can least cope with COVID in their communities are now being infected because people have come or gone to those locations against the orders, and it's just crazy stuff that continues to put people at risk. So we would certainly ask that you hear us, work with us on this message, and try to keep yourselves and the community as safe as we possibly can. All our local emergency management committees are meeting almost daily right across the region. That cross-section of agencies and emergency services are there to work with communities, to work for communities, to do whatever we need to do in those places to get the services delivered to keep people safe. So please, work with us. If you have any issues, please raise them in your local communities with your local representatives there, and we will do whatever we can to help you. That's about it for me today. I'm happy to take any questions anyone might have on the computer there.
Thanks, Jeff. Could I, for the sake of time, could I just ask everyone in the meeting to raise their little digital hand if they have a question specific for Jeff? Just take 5 seconds to do that and we'll run through them. Doesn't appear as though anyone has any questions for you today, Jeff. Thank you very much.
I can't see any little digital hands. Thank you very much. Cheers.
Good on you, mate. Thank you.
So we will move on to Dougal now. As we said, in the invite, Dubbo Media will be invited to ask questions first. If anyone else has a question for Dougal, can you raise your little digital hand, please? But we'll run through the Dubbo guys first. Hamish from Prime.
Thanks, Matt. Dougal, is there an update as to whether you're classified, Dubbo will be classified as a hotspot?
Look, regarding any hotspot classification, it's something, and I've mentioned this for the past couple of days, I guess I've heard from different sections of the business community, certainly from the Chamber of Commerce and a range of other different styles of business. It's something I flagged last week as a possibility. I've spoken to the Deputy Premier about it again over the weekend. At this particular point in time, I don't believe that is the right thing to be doing, but we will keep engaging on that. If we do become one of those areas of concern, a hotspot listed area, a lot of things change, including applications of curfews and a few other things that will completely change what we're able to do now while still maintaining stay-at-home orders. So, look, it's an evolving situation. I talk to the Deputy Premier nearly every day about it. If and when the timing becomes right, we will look at it then. At the moment, I don't think that time is right, and at this stage, we won't be proceeding down that route.
Am I allowed to follow up that?
Yeah, one more if you want.
And do we know the ins and outs of how many people have received a first dose and a second dose, particularly around Dubbo?
Look, I'll let Scott probably handle that in a bit more detail. Over the weekend, around 1,500, but there's many, many more thousands than that have been through the main vaccination clinic, the booked clinics, through their pharmacies, through GP clinics and through the AMS, that sort of thing. So I don't know that we have access to all of those numbers, given this is a federal rollout program, so the feds might have some different figures on that as well. But from a health district perspective, Scott can probably talk a bit more to that in a tick.
Perfect, thanks Hamish. Gary from ABC Western Plains, do you have anything for Dougal?
No, nothing for Dougal.
No, perfect. I can't see any other little digital hands up, so
Excellent.
if anyone has anything specific for Dougal, please speak up now.
All right, well, let Scott come.
Yep, thanks Dougal.
Thanks, mate.
Okay, so Hamish, we'll kick off with you again if you wanted to ask that one of Scott.
Yes, Scott, I'll just ask that question again. Do we know any facts, any stats on how many people within Dubbo have received a first dose as well as a second dose?
Hamish, there's a New South Wales Health website that's got all of the vaccination rates down to each LGA and each locality on the New South Wales Health website. I would really encourage people to go and look at that. Now, the last I looked, late last week, Dubbo was around 44% people with the first dose and around 17% with a second dose. Now, I reckon that's increasing daily, and so there's some pleasing signs there with the scale of vaccination programs rolling out right across Dubbo. Our vaccination hub through the local health district is open 7 days a week and vaccinating with both AstraZeneca and Pfizer. The ADF are in town right through until the end of this week. And there's a lot of GPs and Aboriginal Medical Service, pharmacies in Dubbo as well. So I really would encourage everyone to look for a vaccination opportunity.
Great, thanks Hamish. Did you have another one for Scott?
No, that's all good, thank you.
Matt, I might just follow up there with a comment around, listen, we know that there's about a third of the Aboriginal people compared to the total population that have been vaccinated, both within Dubbo and around this region. There's a perfect window of time in the next week for all of the Aboriginal community to come and get vaccinated in the walk-up clinics with the Australian Defence Force, and so I really would urge Aboriginal community in Dubbo to please come out and look for opportunities.
Thanks Scott. We have one that's come in from Emily Wheeler who's having mic issues at the Daily Liberal. Are any of the Dubbo Hospital patients transferred from one of the northwest communities?
Yes, there are. But there's a number of patients in Dubbo that are from surrounding communities from Dubbo. I don't have the details on that at the moment, but we know that the last thing that we want is for patients to end up in hospital, particularly end up in intensive care. It's the reason that vaccination is so crucial. And it's the reason that early diagnosis of COVID is so crucial. We can stop it deteriorating if we can catch it early. And so really I would encourage everyone right across the whole of the region, particularly the northern part of our region. We've got some incredibly vulnerable communities, a long way from acute care and a long way from your family members if you do get seriously ill.
Thanks Scott. Gary from ABC Western Plains.
Thanks, Matt. Hi, Scott. When we first started getting these daily updates, we were hearing a lot of the cases were among school children, particularly under the age of 16. Can you confirm if that's still the case? And can you also give us a bit of a breakdown in terms of the numbers, so we hear that broad number? How many of the current and active cases are actually children under the age of 16?
Sure, thanks Gary. So we've got a growing number of cases in the older population. Last week we only had one person aged over 70 and that's now 3. We've got a significant growth in the number of people aged between 50 and 70 that have been confirmed with COVID. We've got around 45% of the cases are aged under 20, and so that's a decreasing percentage and increasing for a lot of the older population. We know that in the last 24 hours, there was about 40% of the cases were infectious in the community, and so this for me says in any of our towns there can be people with COVID. They can be of any age, any background. We just need to assume that it could be you, your neighbour, the next person you're standing behind in the supermarket. So please, everyone, come and get tested as quickly as possible, get vaccinated as quickly as possible. And we've got to get in front of this in Western New South Wales.
And just to continue on that, we talked about vaccination rates just now. You mentioned around 2,400 in Dubbo. Are the fewer numbers of cases we're getting related to fewer tests? I.e., do you think that there are cases that are still around that aren't getting picked up in those testing numbers because they are dropping?
Gary, I've got no question. There's people in our communities, probably right across the region, that they are infectious in our communities at the moment. We know that there's been cases over the last week and 10 days that have been infectious in the community, passing it on to others. The most urgent thing we can do is come forward and get tested if you've got any signs and symptoms, however mild. It really scares me, the number of people that could be in Western New South Wales unknowingly spreading to other people around them, or picking it up from other people thinking that they're safe. And so it really is time for some vigilance and urgency around it.
And sorry, Matt, I'm going to be really cheeky and ask just really quickly a third question of Scott, just about Gadooga. 6 cases now, that's a small Aboriginal community, probably the most remote community in the health district. What sort of efforts are being done to try and, I guess, protect and help that community?
Well, we know there's a lot of concern around Gadooga at the moment about the growing number of confirmed cases in the community. It's a community that we've got at the absolute top of our priority to make sure that we can help people get tested, get vaccinated, stay safe in the community. Can I please just urge everyone in Gadooga, I know it's tough, I know it's a big family in the whole of the community, but it is time to keep your distance, stay at home wherever possible. We are caring for the confirmed cases that are still in Gadooga, and so please, I would urge everyone, just show some love and appreciation for everyone across the community.
Great, thank you.
Thanks, Scott. Thanks, Gary. Claudia from Prime Orange, who's going to, Scott, for your references, she's going to ask 2 questions for herself and 1 for Chris in Parks.
Cool.
Thanks, Matt, and hi, Scott. My first question's in regards to the orange cases. Can you talk us through the sources of those cases and whether they're linked, and particularly the 6 who are residing together but are from Greater Sydney? How concerning is that for the community, and are they complying with contact traces?
Sure. So the 6 confirmed cases that we saw over the weekend in Orange, we know have come from Western Sydney. We're pretty confident that that's where they picked up the infection. But we also know that they've been working in Orange over the last week and 10 days. There are a few locations of concern that have been identified, but I think we do need to assume that they've been infectious in the community, and there could be some broader spread across the community of Orange and any other surrounding towns and people that might have visited Orange. It could even be prior to the stay-at-home orders coming into effect. And so I'm going to really urge everyone in Orange and surrounding communities, if you've got any signs and symptoms, however mild, please come forward and get tested. I would also ask that, I know that's a really scary time when you're told that you've got COVID, but the best thing that you can do is be upfront and honest and help us figure out where you've been, where you might have been spreading COVID around the community, and how we can stop impacting on other people. And so I really would urge, if there's anyone that's in that situation, then please help us get in front of this.
And in regards to those 6 patients from Greater Sydney, or Western Sydney, sorry, are they complying with contact traces, and do we know whether they were getting tested every 3 days?
I believe they're still in Orange at the moment, and we've got a lot of support being offered around the household. As far as I know, they're complying with that and receiving support.
If I could just sneak one in about Bathurst, that would be great.
Sure.
The cases over the weekend, the 6, are they all linked, and are you concerned that it's going to spread further?
So we're incredibly concerned about Bathurst. We know that the vast majority of the cases that have been identified, 6 in total, were infectious in the community. There are a couple of locations of concern that have been identified where we haven't been able to get in contact with the people that have been in those locations. But it's not about those locations. These are confirmed cases that have been active in the community, could have spread to other people. And so I really would urge some urgency. for the community, come out and get tested as quickly as possible. We don't have clear links for all of these cases, and so we really are quite concerned that there might be other people across the community still spreading COVID.
Thank you so much. Now finally, just for Chris, regarding the situation in Perth, are you expecting exposure sites to mount in the coming days? And how concerned are you that it is in the community, given and the low testing rates? I mean, 74 in the last 24 hours. That's quite appalling.
There's some real urgency. The community of Parks, we know that the confirmed cases that have been identified have been infectious in the community. It's a real time to be quite definite that please, if you have any signs and symptoms, however mild, any concerns at all, please come forward and get tested. The drive-through clinic is still available at the showground in Parks. It's very quick to get tested. The testing turnaround times are coming back much quicker and quicker these days, and so please, I would urge everyone, any signs and symptoms, however mild, please come out and get tested.
So much.
Thanks, Rob.
Thanks, Claudia. Rob from Wing.
Hey, just checking with the ADF pop-up clinics that are going around the region, will that change if there becomes a particular area of concern? Is there flexibility to change that schedule?
So we've planned meticulously with the ADF and police to get a program right across the whole of the region. There's a couple of communities where we've been able to find actually a good and longer, better solution for those communities like Wellington. We're always open to making sure that the right locations and priorities are going to be considered. We've got a lot of vaccination programs and services available at the moment right across the GPs, the Aboriginal medical services, the respiratory clinics, the vaccination hubs, the local health districts running, and the Australian Defence Force. So please kind of encourage everyone, look for those vaccination options. Go to the vaccination eligibility checker on the Health Direct website or call Health Direct, and you'll be able to book in there for those other programs. And the ADF clinics are a walk-up clinic with both AstraZeneca and Pfizer available.
Thank you.
Thanks, Rob. Joanna from ABC Central West.
Thank you. Mr McLaughlin, with regards to the cases in Bathurst and Parks, do you know where the infections there have originated from?
You know, there's still a number of the cases in both Bathurst and Parks that we haven't got links to where the person picked up the COVID strain. And so we are really concerned that there are other people infectious in the community. It is really time to come and get tested as a matter of urgency.
And you sort of touched on it before with regards to the orange cases, so 6 construction workers. Can you confirm whether or not they were working on the Taco Bell development on the Mitchell Highway, and are there likely to be more venues of concern listed?
I haven't got details on where they were working, but I think we should assume that they've been out in the community while infectious, and so it is real time for everyone to show some urgency. We've worked through as much of the contact tracing as we can to get the locations of concern identified. We are concerned that there may be others that haven't come out of that contact tracing, and so I really would urge some attention to come and get tested if you've got any signs and symptoms, however mild. The 2 drive-through clinics are available in Orange today at both Orange Showground and Wade Park, and so please, today's the day, come out and get tested, particularly before the snow sets in.
Thank you.
Thanks, Joanna. Laura from the Canberra Times.
Hi, Scott. Can you confirm progress with the testing clinic in Glargenbone, considering the positive cases?
Yes, we do have testing available in Glargenbone today, and so I really would encourage the community to come out and get tested in Galar and some of the surrounding villages.
Thank you.
Thanks, Laura. Riley from the Central Western Daily.
Hey, so you touched on a little bit before with the Orange 6 positive cases. There's since been a 7th case identified in Orange. Do we know, is that a household contact of those initial 6, or do we know sort of the movements around that case?
For the seventh case that we'd identified in orange, we don't believe is connected to the other 6. We do also believe that the person's been infectious in the community, and so it's another signal for the community of Orange and surrounding communities. Please come and get tested if you've got any signs and symptoms, however mild. It is quite urgent.
Yeah, thank you for that. And the other question, so a lot of pretty much all the new locations that have been, been in COVID, that's protocol. Can you clarify why so far those locations that have been identified, they're only being classed as casual contact locations? I know Woolworths, there's about an hour and a half total time spent in there by the COVID positive people. Why is that just a casual contact rather than the major one?
Sure. So the first thing our contact tracing team do is identify if we can lock down all of the contacts and people that were in a facility. That means that we can be confident that we've got to everyone with a text message and a notification that either they're in a location as a close contact or a casual contact, and with some advice around that. If all of that can happen, then there's no reason for us to go out publicly to notify anyone that there's an issue of concern. In big facilities like a Woolworths, a Bunnings, or those type of locations, where we're sure that people have been wearing a mask, we're sure that there's been some decent social distancing, and this can come from CCTV footage and a range of other things, including the layout of the facility, who was in the facility at the time, and what the potential risk was. Then those are the things that add up to all of our specialists taking stock of, is there any risk for people in that facility that may require them to be a close contact, that requires a 14-day isolation and testing along that journey, or a casual contact. And so those are the things we've got specialist teams working on every hour of the day, and so we will advise those as quickly as possible.
Cheers for that.
Thanks, Riley. Bradley Jerd from the Western Advocate.
I just wanted to ask you about the 6 in Bathurst. Do you know if they're known to each other, or whether they're related, or household contacts?
Sure. So out of the 6 cases in Bathurst, we haven't found links between all of those cases or to a potentially source case. And so I really would urge some attention and urgency to coming and getting tested as quickly as possible. We know that there's spread around Bathurst, and I really would urge the whole of the community, come and get tested if you've got any signs and symptoms, however mild.
And on the 6 of them, have all the contact tracers, have they contacted all the venues of concern for those people? Could we have more venues of concern from those 6 people announced in the coming days?
So now contact tracing teams will continue to work through any of those, but we're sure that for the locations where we've had a confirmed case and we've been able to get in contact with everyone that was in that location, then we haven't needed to notify that publicly as a location of concern. I know this is confusing and concerning for everyone, but if I can give an example, if it was a service station late at night and there was no one else in the service station, then we haven't needed to notify publicly as a location of concern. That applies to whether it was a general practice, another community-based facility, and so please, everyone, keep your eye on that list of locations of concern. We are getting that out much faster through our Facebook page and other mediums to notify the community in advance of it going up on the New South Wales Health website.
Thank you. Thanks, Brad. Ashley from the Canowindra Phoenix. You there, Ashley?
Hi. Thanks for your time. I was just hoping to ask what the process in planning is for small communities like Canowindra and the surrounding areas.
Sure. So we've been doing a lot of work over the last 12 months to look at our services in the community, how we can support people that have either got COVID or close contacts and household contacts, the range of hospitals and health services that we provide that are just so crucial to our community. A community like Canowindra, we know Canowindra plays a really crucial role in the network of particularly our acute care services across the whole of the region. And so it is identified as a location that we will need to look at what type of patients we can provide care to in the future if we do have an outbreak locally. This is one of the most urgent things. We know the connections between Canowindra and some of the other locations with COVID cases is pretty strong. And so please, everyone in Canowindra, please come and get tested if you've got any signs and symptoms, however mild. Don't hesitate to come and get a vaccination. We know there's GPs and other services around town that are vaccinating, so please, this is the time to show some urgency.
Fantastic. And the other question is about the pop-up sessions. We've got one coming up on the 1st of September in Canowindra. Just to let the population know, can you just tell us how it will run on that day?
Sure, so it'll be a pretty exciting day for Canowindra. We'll see the ADF come into town with a team of expert vaccinators and support people. That's a clinic that anyone can walk up to. Anyone over the age of 16 that wants a vaccination, or if you're over the age of 12 and you're Aboriginal, or you've got a chronic and a serious health illness. So please can urge the whole of the community to look for that opportunity, but don't wait. There's other opportunities for vaccination that could be available, and particularly for AstraZeneca. We know that the GPs in town have a good supply of AstraZeneca and are available to vaccinate people.
Fantastic. Thanks, Scott. Have a great day.
Thank you.
Thanks,
Thanks,
Ash.
Matt.
Talia from the Ningen Weekly.
Hi, thank you for your time. I just had a question in relation to the exposure site that was added in Ningen late last night. Obviously that was, I think it was 8 or 9 days ago, but there's currently no active cases in the Bogan Shire. Do you know anything about this case, and was it someone passing through or someone in the community?
We've identified a location of concern in Ningen. We believe it was a person that's passing through that's identified that. It's since become a confirmed case. And so there's a real risk there in Ningen and all of our communities that anyone standing beside you in the service station, in the supermarket, or someone in your household could have COVID. And so I really would urge people in Ningen to come out and get tested as a priority if you were in the location at the time, or even if you have any signs and symptoms, however mild.
Beautiful. Thank you so much.
Thanks, Talia. Thank you, guys. That's everyone, so we'll wrap up there. Thank you again for attending. I'll get the recording out as soon as possible.
Thanks, Matt. Thanks, everyone. And take care.